Hi, we are back, and you should have just finished watching this short video about high blood pressure, and I'm hoping it gives you an idea of the importance of high blood pressure. If you notice, they called it the silent killer, and there are many people that do not know they have high blood pressure. Really, the only way to know is to have it tested. You wouldn't know from any kind of symptoms, really. So it's important to know what your blood pressure is. And speaking of knowing that, when you go to the doctor and they check your blood pressure, you get two numbers. You get, they'll usually say like a number over a number. For example, for normal blood pressure, it should be somewhere around 120 over 80. So the top number is the amount of pressure that is put on your blood vessels when the heart is actually doing the pump. And then the bottom number, the diastolic number, or the 80, is the number that is signifying the amount of pressure on your vessels when your heart is relaxed. Because if you know anything about the heart, it'll pump and then relax, pump, relax, and I'll just keep going through that cycle. So the top number is the pumping, the bottom number is the relaxing. So it should be somewhere around 120 over 80. Many of you will be lower than that just because you are young and healthy, and that's okay. The only time low blood pressure is a problem is if you're passing out as a result of it. But if you have low blood pressure and you're feeling good, that's definitely a good thing. So 120 over 80 is about the average normal blood pressure. And when we think about high blood pressure, that would be diagnosed if it gets to 140 over 90. So those are some important numbers to remember so that next time you get your blood pressure checked, you'll know if you are in the correct range or not. Here's another controllable risk factor that has to do with cholesterol. And high levels of cholesterol in your blood are going to increase the risk of plaque formation, which are those fatty deposits on the artery walls. And remember, there's that word again, atherosclerosis. Those are those fat deposits that has a name. And this comes mostly from your diet. I'm going to show you a video. I'm going to have you watch this video that's coming up next about blood cholesterol, and then we'll talk a little bit more about the difference between good cholesterol and bad cholesterol, because there is good cholesterol. So I'm going to stop this now, and then I want you to take a few minutes to watch the video about high blood cholesterol, and then I'll come back and talk about the good versus the bad.